What if there is a vaccine which is not available? So you are COVID-19 positive, you had the infection in the past. Currently, you are planning to take vaccination, but in countries like India, the vaccines are not available, the dates are not available, the dosages are not available. What should you do? How long can you wait before you get yourself vaccinated? Now, post infection, if the vaccines are available, get yourself vaccinated. No brainer. Vaccine available post infection, meaning you had COVID-19 in the past, you are currently having the vaccines available in your region, go get yourself vaccinated as early as possible. How long can you wait? You should get vaccination within a span of 6 months following your earlier positive test results. So within 6 months of your infection, get yourself vaccinated. What if you do not have a vaccine? There are regions in the world, specifically in India, where the vaccines are not available. What do you do in that case? You cannot get vaccinated. It's not your mistake, it's not anyone else's mistake. It's just the vaccines are not available, they are not geographically present in your region. So what you can do is you can wait for at least for a maximum 6 to 8 months before getting vaccinated. So you wait for 6 to 8 months before getting vaccinated. That's how the post infection status is currently. Vaccines available, get yourself vaccinated. Not available, wait for 6 to 8 months max. And after that, get yourself vaccinated. That's our second information. Now, infection after vaccination. This is again a very critical scenario. Um, a person who was normal, after being normal, they get the vaccine available in their region, they go and get themselves vaccinated. What happens? They get vaccinated with the first dose, and they come home and they develop symptoms of COVID-19, and they are now infected with COVID-19. They have positive test results with COVID-19, and this is happening before the second dosage. So first dose, a normal person with first dose gets an infection with COVID-19 before the second dose. What should they do? During this period, this again acts as if the person has a mild infection. So do not get yourself vaccinated at this moment. Wait until the negative report comes in. Negative COVID-19 test reports are there, and isolate yourself. Follow the guidelines which are given to you by your physician, and you should be good. Once you are completely recovered, once you have a negative result, then you go for vaccination. First dose, post that you get infection. Before the second dose, don't vaccinate yourself right away. Wait till the negative results. Isolate, follow guidelines, follow the home isolation, and you should be good. What is the general trend of second vaccine dose? What are the general timelines? Now, in general, I will be talking more about the Indian scenario, where the news is mostly focused on. So COVID-19 vaccine types in India, there are two types of vaccines which are currently available: Covaxin and Covishield. Now, Covaxin and Covishield, these are the two widely available vaccines in India. Sputnik has recently been introduced, still not available, but yeah, it will be available in next few days. So, in case of Covaxin, how long can you wait after the first dose? The maximum you can wait is 28 to 48 days after the first dosage. So, you had your first vaccination done, you can get your second dose on the 28th day, or till you can wait for 42nd day and get yourself vaccination done for dose 2 on 42nd day. So that is for Covaxin. Covishield, now, Covishield has a little bit longer wait time for the second dosage. Here, you can wait up to 42 to 56 days after the first dose. So, if you had your Covishield done, you can get your second dose on 42nd day, or in between 42nd to 56th day. You can get your second dosage done. Now, if a person who has a COVID vaccine, a COVID infection earlier, previous infection with COVID-19, what are the data, and what is more kind of a elaborate in these cases? Which vaccine should be given? Now, with the current data, what we can say is Covishield works faster in the people who already had previous infection. The data will be more granular in future, and I will make separate video on that. But for now, previous infection, Covishield works faster than Covaxin. The vaccine breakthrough cases. Now we have seen one case where one scenario where a person goes for a vaccination, gets the first dose done, the second dose, before the second dose, the person gets positive. Now, what can after second dose or with the full vaccination, can a person still get COVID-19 infection? Yes, they can. Again, yes, they can get an infection even after the full two dosage of COVID vaccine. Now, those are termed as vaccine breakthrough cases. There is a very few percentage, in a single digit, the percentage are for the people who are fully vaccinated with two dosage and still get COVID-19 infection. Now remember, COVID-19 is replicating fast. It's getting mutated fast. So there is one mutation which is called as double strain. There is a second or triple mutation which is triple strain, and these infection, the double and triple strains, are very common in India. There are cases being reported for double mutation is rampant. The second wave is mostly because of the double mutation, and the triple mutation is also getting or catching up, and there are a few cases reported with the COVID-19 triple mutation. So a vaccine breakthrough cases, you're fully vaccinated, you can still get COVID-19 infection. So follow precautions, follow isolation, mask, sanitization, isolation. That's the best strategy to avoid being in this category of very few people getting a vaccine breakthrough cases. Moving on, reinfection. So, as I said earlier, the expiry of a natural immunity happens within 6 to 8 months. So, can you get reinfection even after vaccination? Yes. Expiry of a natural immunity happens post infection. And that's why it's important that even if you are COVID-19 positive, you have a chance, you get yourself vaccinated. Don't think that you have a herd immunity and you will never get infected. You can get infected. So expiry of a natural immunity does happen after the COVID-19 infection. So you had the infection, your herd immunity can get lost in the over the period of time. So vaccinate, vaccinate, vaccinate. Reinfection increases with time, meaning a person who had the COVID-19 infection earlier now can again get infected within 6 to 8 months period. The reason again is a faster mutation in the COVID-19 virus, and that's why whenever you have a chance, you get yourself vaccinated. You have an expiry of a natural immunity within 6 months period, so you vaccinate yourself. Reinfection happens usually within 6 to 8 months, so again, get yourself vaccinated. Now, this is a very critical scenario. What is the vaccination schedule in case of a females? The females who are menstruating can get vaccinated. Females who are pregnant can also get vaccination done. Females who are lactating, who are breastfeeding, can also get vaccinated. Now, these are certain myths, and the myth buster I'm telling you here right away: anyone and everyone who's a female, who's menstruating or pregnant or lactating or breastfeeding should get yourself vaccinated with full two dosage. The benefit always outweighs the risk. So there are huge risks involved with COVID-19 infection. So whenever you have a chance, get yourself vaccinated. So vaccine prevents the disease, not the infection. Why I said in all the infected cases also you should get vaccinated. The reason is the vaccination, this is a coronavirus. This is a vaccine. With the vaccine, you can reduce the coronavirus severity, meaning vaccine prevents the disease, not infection. The the infection will happen even after getting a COVID-19 vaccine, you can still get infected, but But the severity of the infection, the mild cases will not progress to moderate or severe cases if you have vaccination done. If you do not have a vaccination, so you do not have a vaccination done, you had the infection or you never had the infection, you don't get vaccines, you will develop something which is mild disease initially to begin with, and if not taken cautiously, it can progress to very severe disease and it could be fatal. So get yourself vaccination done. Vaccine prevents the severity of the disease, not the infection. So you can still get infected, but not will not have that severe of a symptoms. And that's pretty much, I just want to tell you that these are all the attempts to make and simplify the guidelines. This by means no replacement for your government, federal, WHO, CDC guideline replacement. This is just an information sharing. Please seek your official government sites for recommendation. Consult your physicians or local authorities for best guidance and follow their guidelines. Trying to help you guys, this is what I feel will be easiest and will make things easier for you to understand. This we are recording on the May 2021, and these are the guidelines till this date. So that's pretty much. Thank you again, everyone. Give me a feedback and review. What else do you want to learn about the corona and COVID-19 vaccine? You can get in touch with me on the contacts displayed on the screen. Thank you and have a wonderful time. Give me feedback and ask me questions if you have any. Good luck. Take care of yourself. Isolate, follow hand sanitization, mask, or better, double mask. Good luck. Bye.